It's really my treat and my pleasure to join all of you here tonight. We have an intimate room, which means we have a wonderful opportunity to interact. In just a moment, I'm going to ask our panelists to come up and join me. I want to just make a couple of comments. Firstly, the reason I'm married is because of Evelyn. She knows that I'm telling the truth. So, secondly, the idea for tonight's symposium, breast cancer is not all one disease, really grows out of the amazing work that the researchers throughout the BCRF and here in New England have been doing. And the theme is the teasing apart, the separation of what we have historically thought of as one disease, breast cancer, into many subtypes. And it just happened that this past week I was asked by a reporter on a science story for lay people why this was a good thing. The science reporter was actually concerned. She said, well, if breast cancer is really many different diseases, aren't you telling us that the battle is impossible? How are we possibly going to solve the problem of breast cancer when it isn't one problem, when it's 5 problems or 10 problems or 30 problems? And in fact, as I hope you'll hear from the panel in just a moment, the answer is in fact in this specialization, in this subsetting of the disease, because with that we have the ability to identify weaknesses, targets that we can then go after. And indeed, most of the major advances that have made the news and changed care for patients around the world with breast cancer have grown out of the rudimentary steps we've made towards subsetting breast cancer. So that's really the background for what we're going to talk about tonight. And so I just want to ask all the panelists to come up. I'm not going to introduce them just yet. They're going to introduce themselves in just a moment. As they're making their way up here, I just want to explain. Yeah, that's me, right. You can, yeah, I don't think it's going to work. I'll keep it here. I'll know that I'm standing here. There we go. It's good for me to stay oriented. So each of the panelists is going to take a couple of minutes, and they're going to do something that's really hard for educators and scientists, and that is that they're going to talk without audiovisual aids. So for many, many years, people that give talks know this. You stand up in front of an audience, you have your beautiful slides, and people say, you spend so much time on them, what are they for? And if you ask any of these panelists what they're for, they're primarily to keep the speaker on topic and focused. And the slides are all about the speaker. So it's really hard to give a talk and stay focused and coherent sometimes without them, but this group can do it. Each of them will introduce themselves, their name, where they're from, and what the BCRF funding has supported in their labs or in their clinical research. But I do want to emphasize again what Evelyn pointed out, which is the front rows of the room are filled with some of the many talented BCRF-funded investigators from New England. And as we get into the exciting question and answer part, which is always the fun for us, we may well, and we will certainly ask some of the people in the audience to comment, because there are people in this room who collectively can tell you everything about how to diagnose, treat breast cancer, what's in the future, and what is really exciting in the lab these days.